Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over exercises that can loosen a stiff knee, offering relief within seconds. This video is going to be extremely helpful for anybody that can't open or straighten their knee without pain or discomfort. Just a quick note, each one of these exercises works differently. They're going to target different muscles, different areas of the knee. To get the best results, go through them all and use what gives you the most relief. With that being said, let's get started. So the first thing that we need to do is focus on lubricating our stiff knees to loosen them up. That is bringing blood flow into the soft tissues, including the muscles, but also helping to improve the circulation of synovial fluid in the knee joint. That's like WD-40 for your knee. It just makes it where you're able to move it with less clicks, pops, and pain. So here's a really easy exercise that you can do first thing in the morning because we can do it right at the edge of our bed. I always like to target the most painful, achy side first. Let's say that's our right knee. What I'm going to do is slowly raise that side's foot upward towards the ceiling, trying to open up and straighten my knee as much as possible. The key with this exercise though, don't go to the point of any pain or discomfort. So for me, if I went a little bit further, I would start to feel that. At that point, I just open up my knee as much as I can, hold it for about 3 to 5 seconds, release it, and then keep repeating this over and over again for 10 to 15 repetitions. And with each repetition, just trying to build into it a little bit more. What you're going to notice is warmth will come into the knee. That's that blood flow that we're looking for. But more importantly, you should have a little bit more pain-free range of motion to the point where you could probably straighten your knee without any issues. But just keep repeating this until everything is nice and loose or you're not getting any more improvement. But if you do have a stubborn knee, maybe you have a lot of arthritis in there and you need to take this one to the next level, this is what we can do. We can add in a couple more movements. The first one is just taking our foot inward as much as we can until we feel a good opening stretch on the outside of our knee, and then we're going to repeat lifting that foot towards the ceiling. You can also take your foot outward as much as you can and then repeat. If you notice any of those positions are offering more relief, keep building into that over and over again until everything is nice and loose or you're not getting any more improvement. Just remember though, whatever you do on one side, always do on the other to keep everything in balance. Another way to take this one to the next level is by doing pendulum swings. I really like this one. So for this one, let's just scoot forward a little bit from the edge of our bed, and we're going to start off by just swinging our feet from side to side. I would just go a couple inches, just to the point where you feel a light stretch on the outside and the inside of the knees. Hold that for a brief second, swing towards the other side, and just keep repeating this over and over again. And with each repetition though, with each swing, you want to make the next one just a little bit more to the point where you're really building into this movement and taking your feet off to the side. You can also do forward and backward swings like this. Again, start with a light swing, and with each repetition, just make the next one a little bit bigger to the point where you're doing a really good kicking motion like this, or you're able to fully open up your knees. Go through all these movements, target the ones that are just offering the most relief. Here's another really good mobility exercise that we can do in bed or on a floor. For this one though, I would wear socks because we're going to slide our feet back and forth like this, and you want to reduce friction as much as possible. So let's start lying flat on our back. The first thing that we're going to do is straighten our knees out as much as we can and do a movement called the gas pedal. So imagine your feet pressing into a gas pedal. Just press your toes and the balls of your feet away from you as much as you can until you feel a deep activation into your calf muscles that works upward towards the knees. Really focus on feeling it into the knees with this movement. Once you do, you're going to hold this comfortably for a second or two, release it, and now go in reverse, bringing your toes back towards you. It's going to hit the muscles a little bit differently, so you just again want to hold that for a second or two and then just repeat this going away and towards you over and over again for 10 to 15 repetitions. But if it feels like it's really helping out with all of these movements, you're more than welcome to throw in as many repetitions as you like. So from here, I like to do the windshield wiper. This time around, I'm going to swing my feet towards one side as much as I can, hold that for a second or two, and then swing them towards the other side, doing that 10 to 15 times. At this point, you should feel a lot of warmth coming into the knees. That's that improved blood flow and also improved circulation of synovial fluid. So now let's focus focus on our knee slides. We're going to bend our knees, have our legs roughly hip width apart, and I just like to gently press my heels into the bed of the floor, just to the point where I feel a really light activation into my thigh muscles, working towards my hips, possibly even into the lower back. We're now going to slide one heel forward, maybe an inch or two, just to the point where you feel a little bit of an opening stretch in your knee, not to the point of any pain or discomfort. We're going to hold that for a second, slide it back, and then repeat on the other side. What you want to do with each repetition is a nice fluid movement of trying to go out just a little bit further with each one, to the point where you can pretty much just open your knees without any pain or discomfort, or you're not getting any more improvement. I would at least try to do this maybe 10 to 15 times, but if it feels like you need a little bit more, just keep throwing more repetitions in. Here's another really good mobility exercise that's also going to add in a soft tissue massage. This one is known as muscle scraping or gua sha, and I usually get relief within 30 seconds. I really like this one. You're going to need a couple different things. The first being a large metal spoon. You want one with a little bit more thickness. You'll get better results. The next being a form of lubrication. Any massage oil or lotion that is designed to be put on the skin should work. I really like using coconut oil. If you would like to pick this up online, I'll leave a link in this video's comment section and description. This is really good stuff. So the first thing that we're going to do is start seated on a flat elevated surface, one high enough that our feet will not hit the floor. The edge of a bed works perfectly. We're then going to pretty much coat our whole knee with whatever lubricant we're using. Coat on the front, back, sides. We're also going to target the calf muscles. On the back of the thigh, the front of it, we're going to target everything for the most relief. When it comes to the spoon, it doesn't matter what part you use. In fact, while you do this, I would switch up and use different spots of the spoon, because you may find going around the kneecap, the tip works a little bit better. Going over the thigh, the handle works a little bit better. But the thing is, we're only going to go over soft tissue like skin right here. We're not going to go over anything bony like the kneecap, because that can cause irritation. So let's angle our spoon roughly 30 to 45 degrees, and we're going to go right above our kneecap, right into this soft tissue. We're going to apply enough pressure in there where it's going to be a comfortable self-massage, and then we're going to stroke upward like this. It's really important that we stroke upward towards the heart to improve blood flow and circulation. I like to go over one area roughly about 5 to 10 times, and then afterwards I relax and see how it feels. If it feels pretty loose, no pain or discomfort, at that point I just switch over a different spot and repeat. When you do this too, you're probably going to notice that you're going to form red pockets over the top of your skin. I don't know if you can see it right here over the video. That's actually a good thing. That's blood flow coming into the area, which is going to help promote healing. So you pretty much want to do this over pretty much everything around the knee, off to the sides. You want to target your calf muscles, your hamstrings on the back of your leg, your thigh right here over the quadriceps. Any spot that you feel like it feels gritty, tight, or achy, at that point you want to stop over that spot and keep repeating this over and over again until it finally breaks up or you're not getting any more improvement. And if you do have one spot that's just really stubborn, doesn't want to release, at that point I would switch up the movements of the spoon. So instead of just going straight up like this, attack it diagonally, or you can also do kind of a different motion, like a circular motion like this with the tip or the rounded portion. Just try as many different movements as possible until it finally breaks up. So if you want to take this one to the next level and focus a little bit more on loosening up your knee, especially if you have a lot of discomfort trying to straighten it, what you can do is try to straighten your knee out as much as you can, stopping before the point of any pain or discomfort, and then repeat this, targeting any spot that you feel like it is a hot spot for pain or tightness. Like for me, when I lift up like this, I really feel it on the outside of my knee. At that point, I just kind of build into that, try to do that muscle scraping as much as I can, relax it, and then at that point just keep building into this, because what you're going to notice with each repetition, you're just going to have a little bit more pain-free range of motion. So give this a try, and I really hope that it gives very quick relief. So after doing one of the mobility exercises, everything around the knee should be warmed up to the point where we can now focus on strengthening it. One of the easiest exercises that you can do every single day, or at least 2 to 3 times a week, to strengthen the knee for long-lasting relief is by doing what is called the wall sit. All you need is a smooth wall or a door. So what I'm going to do is put my feet out in front of me to the point where I can lean my whole body weight into that door or the wall and have my whole backside flush against it. So you pretty much want from the back of your head, shoulders all the way down towards your tailbone, flush against that wall. From here, you're going to slightly bend your knees and place all of your body weight onto your heels during this exercise. So also, what I like to do to protect my knees just a little bit more is to point my toes out slightly 5 to 10 degrees. It takes tension off of them. So once we've done all of that, what you want to focus on doing is just sitting down, squatting your butt towards the floor. What you want to focus on doing is going down as far as you can until you feel a deep activation into your buttocks, the glutes, working into your thighs towards the knees. Once you feel it in the knees, you're going to hold this comfortably for about 3 to 5 seconds, and then you're just going to stand back up like this. Take a breather, but you want to try to do this about 10 to 15 times. And with each repetition, just drive down a little bit further to target those knees. Afterwards, see how you feel. If it feels like you have a little bit more energy, always challenge yourself by throwing in another set or 2. But for a lot of people, this right here will become pretty easy. So at that point, I recommend doing what is called the goblet squat. It's very similar, but what you want to focus on doing is just not using the wall for support. So have your knees a little bit wider than your hips. You're going to, again, place all of your body weight onto your heels, toes out slightly. But this time around, I'm going to put my hands in a prayer position, press them into my chest. What this will do is help keep your back straight during this exercise. And then you're just going to squat or sit down like this until you feel that deep activation. So progress into this one when you feel ready, because it's going to definitely help strengthen those muscles even more. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.